Welcome to Howard Memorial Hospital, where we've recently started doing cardiac stress testing in our nuclear medicine department. We'll now go over to that department and see exactly what a cardiac stress test consists of. Hello, I'm Stacy Harbison, Radiology Director at Howard Memorial Hospital. We've recently started doing cardiac nuclear stress testing here at Howard Memorial, and we are going to do a quick run through of how that testing actually works. At this point right now in our exam, Sarah has already had an injection of a radioactive tracer that goes to her heart so that we can take images of her heart. She has waited a short amount of time and we have taken a set of images. Now we are in our stress lab here at Howard Memorial. I have connected her to leads and a blood pressure cuff. Her blood pressure will be taken every 2 minutes during this test. And for this particular test, Sarah will get an injection of LexiScan, which is a chemical stress inducer, because she's unable to walk on the treadmill. And that is what the majority of our patients typically get, is the chemical stress, because for one reason or another, they're unable to walk on the treadmill. If they do walk on the treadmill, then we would reach a target heart rate, and then they would get an injection of a radioactive tracer. If they start out walking on the treadmill and are unable to complete it, then that's no problem. They would just sit down in the chair and we would convert the scan over to a LexiScan and go with the chemical route. So at this point, we will have a nurse here with us, and the nurse is watching that monitor the entire time for any kind of heart event that would need immediate intervention.
Hello, my name's Jeff Williams. I'm Director of Education here at Howard Memorial. My job is basically, once we have the patient hooked up and we've introduced the medicine into their system, I monitor the EKG for any type of arrhythmias that the patient may have. The incidence is very low. We haven't seen actually any since we started the program. But I watch and make sure the patient doesn't become symptomatic, has any arrhythmias, and if something does occur, that we have all the medications on board and on hand to combat any type of side effects that may occur. The test normally lasts 10 to 12 minutes. We take vital signs throughout the test, numerous blood pressures, about every 2 to 3 minutes. The patient is constantly monitored through the entire process, and the incidence of anything happening is very, very low.
So Sarah, do you have any questions about the test today?
How long does this procedure take?
You will be here a total of 2 to 3 hours. You have the rest portion of the test, you get your injection, and then you wait 45 minutes, we take images. Then you come back here, we do the stress part of the test, which takes up to 12-15 minutes, and then you have another 45-minute wait, at which time we want you to get about to eat. You can have caffeine, and then we'll go take a last set of pictures, and that second set of pictures is the end of the stress test. Once we do that final set of images, those images will be processed and sent to the cardiologist, who will then interpret and get those results back to your PCP or schedule you for an appointment and determine what your next step is, what your plan of care will be. We are so pleased to offer nuclear medicine cardiac stress testing here at Howard Memorial Hospital. If you have any additional questions about the test, please give us a call at 870-845-8077 in the radiology department. Or if you or your primary care provider have questions about scheduling or would like to schedule an exam, please call our centralized scheduling department at 870-845-8156.